Tonight's final bedtime lesson is about flu. The flu is a common infectious viral illness. You can catch the flu all year round, but it's especially very common in winter. This is why it's also known as a seasonal flu. You can catch the flu many times because flu viruses change regularly. Your body won't have a natural resistance to the new versions. Flu symptoms. There's a lot of them. Some of the main symptoms of flu include, here we go, a sudden high temperature, tiredness or weakness, a headache, general aches and pains, a dry chesty cough, sore throat, difficulty sleeping, loss of appetite, diarrhea or tummy pain, feeling sick and being sick, chills, a runny or blocked nose, and sneezing. The symptoms are similar for children. They may also get pain in their ear and be less active. How long do they last? The symptoms of the flu usually develop 1 to 3 days after becoming infected. Most people will feel better within 1 week. But you may have a lingering cough and still feel tired for a few more weeks. Flu-like illness self-help guide. Anyway, let's not ignore that. Go phone 999 or go to A&E if you have severe difficulty breathing. For example, you struggle to speak without pausing, gasping and choking. You have severe chest pain in the middle of your chest that isn't going away. You may feel like pressure, tightness and squeezing. You have pain that spreads to your arms, back, neck and jaw. You feel more drowsy than usual or find it more difficult to wake up. And your lips or skin are turning very pale, blue or grey. On brown or black skin, this is easier to see it down the palms of your hands. Contact your GP practice urgently if you are more short of breath than usual, have pain when breathing in or coughing, are feeling confused, dizzy or lightheaded, feeling sick or being sick. For example, you can't keep foods or fluids down, are coughing up blood, have heart palpitations. This may feel like your heart is racing, going too slowly or skipping a beat like a fluttering feeling in your chest. Are peeing less than usual. This can be a sign of dehydration. And have a very high or low temperature. For example, you either feel hot or cold to touch or you're shivering. Treating flu at home. Here are the do's and don'ts. If you have the flu, there are things you can do to help you recover more quickly. Here are the do's. Rest, get plenty of sleep, keep warm, drink lots of water to avoid dehydration, take paracetamol or ibuprofen to lower your temperature and treat aches and pains, stay off work or school till you feel better. Don'ts. Do not take paracetamol and flu remedies that contain paracetamol at the same time. GPs don't recommend antibiotics for flu. They won't relieve your symptoms or speed up your recovery, sadly. Preventing the spread of flu. Flu is spread by germs from coughs and sneezes. These can live on hands and surfaces for 24 hours. You can help stop yourself catching the flu or spreading it to others with good hygiene measures. Do's. Wash your hands regularly with soap and warm water. Clean surfaces like your computer keyboard, telephone and door handles regularly. Use tissues to cover your mouth and nose when you cough or sneeze. Rinse used tissues as soon as possible. Avoid unnecessary contact with other people while you're infectious. Stay off work or school until you're feeling better. The difference between a flu and cold. It can sometimes be difficult to tell if you're having a flu or cold. Flu symptoms come on quickly, usually include fever and ache in muscles, and are more severe. However, the cold symptoms come on gradually, mainly affect your nose and throat, and are fairly mild, so you can still get around and are usually well enough to go to work. And finally, the flu vaccine. The annual flu vaccine can help reduce your risk of getting flu each year. Time for our storm names of 2024 to 2025. Ooh.